Hi, Professor Grumlin here. It is probably safe to say that COVID-19 has in some way affected your life. Perhaps you or a loved one has been ill, or you've felt the economic or political impacts. Since you're taking a medical microbiology course during a pandemic, you can be sure that the topic is going to come up during this course. The purpose of this video is to provide you with relevant background information about the virus and the disease. The pandemic began in December of 2019 when a few people in Wuhan, China were hospitalized with an unusual form of pneumonia. It was quickly discovered that those first few people had all been to the same fish market. The situation was reported to the World Health Organization very early in January, and investigations proceeded at a rapid pace. By January 5, 2020, they had ruled out all the typical pathogens, and by January 9th, the cause was identified as a novel coronavirus. On January 15th, the sequence for this virus was published on an international open database. At that time, the virus was named 2019 nCoV. This stands for 2019 Novel Coronavirus. The name was later changed to SARS CoV-2 by the International Committee responsible for names and taxonomical classification of viruses. Also on January 15th, the first case outside China was reported. Initially, they had hoped that this was not a communicable disease. Unfortunately, human-to-human transmission was confirmed on January 20th. The first case in the U.S. was reported on January 22nd, and on the same day, the World Health Organization met to discuss this new disease. They declined to take action on that date. By January 23rd, 3 labs had started working on a vaccine, and in the meantime, events were being canceled and transportation systems shut down in the hopes of containing the virus to the Wuhan area. Scientists had established the incubation period by now. Within a week, the virus had spread, deaths had occurred, borders were closing, and diplomats were being recalled. On January 30th, WHO did declare an international health emergency. So here we are, 2 years into this. Hand washing, masking, testing, social distancing have all become routine for some people. Supply chains have been disrupted, leading to empty shelves. Education has been drastically changed. Vaccines and treatments have been contentious. But one thing we can all agree on is that we are ready for this to be over. Let's take a little peek at the virus that caused all this disruption. Coronaviruses were first described in the 1960s. The name corona comes from the appearance of a crown or a corona when viewed under an electron microscope. All coronaviruses have the same common structure. RNA for their genetic material, surrounded by a protein coat, which is surrounded by a lipid envelope with spikes in it. There are many types of coronaviruses, and we've identified 7 that infect humans. 4 of the 7 just cause mild seasonal diseases. But the 3 more recently emerged viruses cause much more severe disease. The original SARS CoV emerged in China and caused the pandemic that started in November of 2002 and ended in July of 2003. SARS stands for Severe Acute Respiratory Syndrome. Interestingly, that original SARS CoV seems to have disappeared. We don't see that anymore. That virus infected over 8,000 people and had a death rate just over 10%. MERS-CoV emerged in Saudi Arabia in 2012 and continues to infect people. MERS stands for Middle Eastern Respiratory Syndrome. This virus has infected around 2,500 people, but has around a 35% death rate. SARS CoV-2 causes the disease called COVID-19. Globally, it has caused more than 318 million cases and more than 5 million deaths. In the U.S. alone, we've reported more than 65 million cases and around 850,000 COVID-related deaths. We've been watching wave after wave of cases of COVID-19 as the new variants of the virus emerge. Although the mode of transmission remains the same, primarily respiratory droplets, each of the variants has slightly different transmission rates, incubation periods, symptoms, and disease severity. As we get into the micro course, you can look forward to a deeper investigation of the structure of the SARS CoV-2 virus and the COVID-19 disease that it causes.